Hi everyone, my name is Jessica and I'm a second year medical student at the University of Toronto. So I was born and raised here in Ontario. I did my kindergarten, elementary school, middle school, and high school here, and I ended up going to UTM for undergrad. I specialized in neuroscience and majored in biology. As everyone knows, U of T is the best university in Canada, and so I think that was a pretty big reason as to why I chose University of Toronto. But on top of that, and some of the more serious things I considered when choosing this school is just the opportunities, especially in research, and the opportunity to learn from the best of the best was one of the main reasons why I chose U of T. And I think my decision in terms of coming to the Mississauga campus was really because it's a smaller campus. It's more close-knit. It's surrounded by a forest, and I love nature. And it's close to home, so I got to live with my parents, which was really nice during undergrad. So in med school, every day is different. So I'll just give you a quick overview of what every day sort of looks like. So on Mondays, we have sort of learning sessions throughout the day, and Tuesdays we have off. So that's the day where we can either use it as a reading day, or we can go shadow other physicians in paths and careers that we're interested in. And Wednesdays, again, we have learning sessions usually in the mornings. And Thursdays, we have our hospital clinical days. So we're at the hospital from like 8 a.m. to 12, and we get the chance to learn different skills and to interview patients, which is always fun. And Fridays, we usually either have our exams on Fridays, and we have our lectures on Fridays as well. So the most rewarding part of my journey so far is getting the opportunity to see patients, see physicians interact with patients at their most vulnerable, and just having the opportunity to be there and to learn from those experiences has just been so rewarding, and I'm definitely so grateful to be a part of this kind of learning experience, which I don't think I would have had in any other career path I might have chosen. Yeah, so one of the biggest challenges in med school, especially in my first year, was getting used to the workload. It is tough, and what they all say is true. You do usually end up completing your entire undergraduate degree in like 2 weeks, which is very interesting to see and be a part of. But that was one thing I had to get used to, and one challenge I had to overcome was balancing learning completely new topics sometimes, and also on top of that, being able to maintain my other skills, like for example my clinical skills, and learning how to interact with patients and how to perform exams alongside learning, I guess, the textbook knowledge. And then on top of that was keeping up with my social life. So having and creating a good work-life balance was challenging in the beginning. It was tough trying to work around everyone's schedules to meet up with people, just because our schedules are always different. And yeah, so that was one of the biggest challenges. And one big thing I did to overcome it was to really make a good schedule and to schedule in activities that really matter to me. So scheduling in specific times where I can meet up with my friends, scheduling in family time as well, so I can see my parents, sit down and talk to my parents and my sister. And yeah, so really just making time for those who I am very close to. Yeah, so after med school, we all end up doing residency in the specialty that we're interested in. And currently I am interested in surgery, but we will see where that goes, just because everyone usually ends up changing their mind once they're or near the end of med school. But in this moment, I am interested in surgery, and that will look like another 5 years of residency in general surgery. So after med school, I see myself working as a resident and hopefully getting paid as well. So the biggest advice I would give to anyone considering grad school, whether that be pursuing your master's, your PhD, going into med school or dental school or pharmacy or anything, I would say sit down and do your research. First, see if that's the field that's right for you. Figure out where your interests truly lie. And if you do think that that field is for you, then you can go into doing an extra layer of research. So this may include reaching out to faculty members, getting exposure to that field, reaching out to students who are in that grad program and asking them questions, doing a little interview with them, and making sure that this is the path that suits you the best. And through this, you'll also gain knowledge on what will prepare you the best for the program and how to sort of write your applications and what experiences these programs are looking for. And on top of that, do your research on the programs themselves. Figure out whether or not you want to stay in Ontario, across Canada, or if you'd like to go international. Figure out which school fits best with your goals and your vision as well. And yeah, I would say to this question, the biggest and most important factor when making your decision is doing good research.